The healthcare system we got was the Spanish healthcare system. A majority of Spaniards use the healthcare system provided by the federal government. That's about 81% of the population. Only about 19% of the Spanish buy their own healthcare. Citizens who use the public insurance use the public healthcare system. It is not available to those who buy their own. The public network is about 800 hospitals and 10,000 clinics all across the country. The private network is much smaller, only has about 465 hospitals and a limited number of clinics. The public health insurance is paid for by taxes from all the Spanish citizens. It costs about 1,421 euros per citizen to cover all the health care that is covered in the public plan. Total healthcare costs in Spain is only about 8% of the country's GDP. Spain is also one of the healthiest countries in the world. This is why the country has such a low healthcare cost. Another reason why the cost is so low per person is because the government and the doctors have the final say when it comes to treatment and care for those on the public healthcare plan. The use of specialists is limited to only necessary circumstances. This way, when a citizen wants to go see a doctor, they have to go through their primary care first. That way they're not wasting money going to see a specialist when a specialist isn't needed.
The requirements for doctors in Spain is to obviously be fluent in Spanish. If you're not from Spain, then there's a language test that you have to pass first. On top of that, there are 6 years of medical school after your undergraduate. And then at the end of that, you would have to pass the MIR test, which is kind of like a completion test of everything that you would have learned in medical school. Once you pass that, you would complete a residency. The length of these residencies can differ depending on what exact field you're going into. After your residency, you would apply for your medical license to be recognized by the Ministry of Health in Spain and officially be a doctor. So the compensation for doctors in Spain is quite low. On average, it's about 57,000, which compared to neighboring European countries and here in the US, that is significantly lower. For private providers, they make a similar amount, but they're paid by an insurance company rather than the government. But private providers only make up probably around 10% because about 90% of the population in Spain is on a public health plan. So since the majority of the country is on a public health plan being paid by the government, governmental organizations are the ones that determine the prices. The Ministry of Health and the Interministerial Committee for the Prices of Medicines are the organizations that determine the price of healthcare in Spain. Usually the Ministry of Health determines which services will be financed, and then the ICPM will determine the prices of primarily medicines. Spain is decentralized, so that means that there's different regions and it's not one overall federal government that is determining the prices for the whole country. But these two organizations work in all the different regions to determine prices for that region. So prices could be different in one region than they are in another.
My name is Nathan Rogers. This is the health outcomes part of the presentation. Taking a look at life expectancy first, we can see that Spain has probably one of the highest life expectancies between the sexes at 83.2 years. This could be due to Spain's free healthcare that they give their citizens if their citizen pays Social Security, if the woman is pregnant and is a resident of Spain, children residents of Spain, and even state prisoners get free state healthcare. Looking now at life expectancy at age 40 to 60, we look at this to kind of reflect the overall mortality levels of a population. Spain is a little bit higher than the US. Infant mortality rates, or the probability of dying between birth and age 1, we can see that Spain is relatively low, where the US is pretty high. How likely are those diagnosed with lung cancer likely to survive? As we all know, lung cancer is a very deadly kind of cancer that in Spain, lung cancer is the 5th leading cause of death in Spain. And in the Americas, lung cancer, the 5-year survival rate is only 18.6%. So it is both very deadly in both areas. And here are just 5 health outcomes I found with death by chronic disease, input birth rate, input healthcare expenditures, the maternal mortality ratio per 100,000 births, and the COVID total vaccine doses administered.
All right, and moving on to health inputs. As you can see in the health expenditure per capita, Spain spends $2,736, while the United States spends $11,582. Spain spends significantly lower. And then the health expenditure as percent of GDP, Spain spends around 9%, while the United States spends about 17.7%. In this picture to the right, this is back in 2018. The numbers I have on the left are more recent. I think it's like around 2020 or 2021. But in the graph, it makes it look easier to understand. Spain is almost half of what the United States is spending on health as a percentage of GDP. Then health factors for Spain and the United States. Now, starting off as population, Spain has around 47 million people, while the United States has around 333 million. So Spain is a lot smaller than the United States. Even with their smaller population, they have a high percentage of elderly people, 19% compared to 16%. So their population is a lot older. I think mentioned earlier in the presentation, I think over on Nate's slides, he mentioned that the life expectancy for Spain is around like 83 years old, while the United States is 78 years old. So they have a older population, which could be due to their healthcare as well. Their obesity rate is a lot lower than the United States. A lot of that can be from their typical diet. Their typical diet is fish, soup, pasta, salads, fruit, vegetables, cheese, rice. They have a Mediterranean diet. A lot of them, that's typical. They have smaller portion sizes. United States typically has very large portion sizes in comparison to the rest of the world. Spain has lunch as their largest meal of the day rather than dinner for United States. So Spain is eating a lot healthier foods than the United States, which could be seen in the obesity rate. Smoking rate, Spain, their population smokes a lot. They smoke more than the United States. That can be seen also. I think Nate's slides as well mentioned that they have a high amount of lung cancer as the primary cause of death. That could be probably seen in their smoking rate. They consume more alcohol per year than the United States. So they're smoking a lot more, drinking a lot more alcohol. They're an older population. Urban living, it's around the same. Rural living, it's more than the United States. And then also with their education. Adults that have completed upper secondary education is a lot lower than the United States. So the United States has more educated people, or at least by secondary education, upper secondary education. Income for Spain is a lot lower than the United States. It's around 24 grand or 24,000. United States is around 45,000. So they're not they're not as well educated as the people in the United States, and they're also making less money. However, um, ba- discussing the economic analysis of Spain's healthcare system, I'd say that their healthcare system is one of the most efficient in the world. I'd say it's very efficient, a lot more efficient than the United States. That can also be seen here. Spain's spending a lot less, and they're having better health outcomes. Their obesity rate is a lot lower. They have going back to Nate's slides. They have a higher life expectancy and a lot lower infant mortality rates. So they're spending a lot less, and they're maintaining better health outcomes for the most part. And also, they have a universal healthcare system. It's a right in their country, so uh, a lot of their population, says 90% of their population's on public health plan. So they're receiving that coverage from the government. And so they have like almost, I think they almost have no out of pocket costs, other than some prescription drugs, but they virtually have no out of pocket cost, which is pretty incredible. And then and I think back on Tom's slides at the top, it says it costs about 1,400 euros per citizen to cover the medical care provided to each citizen. So they're spending around that much money, which is very low for their medical care. And even in comparison to their income, which is 24 grand, that's a very small fraction of their income that guarantees them almost no out of pocket costs, which is pretty incredible and very efficient. Uh, and I think, like I said before, their life expectancy is a lot higher, so they're living a lot longer. Uh, and then also what I was referring to before, lung cancer is the fifth leading cause of death in Spain. That can be seen from their smoking rates. Their older population smoking. Um, Maybe when the younger population will maybe change that, but it just seems a part of their culture. Death by chronic disease, and out 10 deaths, 92% of the total number of deaths. So they have a lot of deaths from chronic disease. Um, uh, but overall, as a whole, I'd say that Spain's healthcare system is very efficient, like I mentioned before, with uh, their universal healthcare coverage, and it's very affordable, and it saves them money on out of pocket costs because they don't have any basically other than some prescription drugs. And but thank you for your time, and thank you for viewing our presentation. Let's see here.